My specialty is in-body contouring surgery, and I'm very pleased and honored to share with you my experience in using the L15 Clarius handheld ultrasound in my practice. Hi, my name is Khanh Nguyen. I'm an aesthetic plastic surgeon and Chief Medical Officer of AVA Plastic and Reconstructive Surgery Hospital here in Ho Chi Minh City, Vietnam. So I use the ultrasound extensively in my practice during patient consultation, before, during surgery, and after surgery. So during the consultation, I will use the ultrasound as a way to educate and communicate with my patients in terms of what their anatomies are, what my findings are, and what my surgical plan for them. In the operating room, I use the ultrasound to plan my operations, to look for abnormal anatomies, to increase my safety margin, and to be precise because I graft a lot of fat and I want to be precise the anatomical plane that I'm grafting the fat into, and the ultrasound helps me identify the plane and make sure that I graft it into the correct plane. During the post-op situations, I use the ultrasound to assess for any post-op complication such as bleeding or seroma, meaning fluid collections. Ultrasound helps me communicate from a very beginning, help me communicate and educate my patients very well because they can see the problems in front of them. They can see whether it's a fat problem, is it a muscle problem, or it's a combined problem. Everybody can see the skin not looking good, but underneath the skin there are more story to tell. And you can tell that story better when you can show the patients what you're looking at. So in terms of communication and education, it has been quite, I would say, revolutionary in my practice, because when you step from a clinical area of medicine where you're treating disease, the endpoint is very clear. You want to treat the disease. But when you move into the field of aesthetic, the endpoint is different. You don't have that clear endpoint as much as when you were in clinical medicine. So having a device like an ultrasound to help me communicate and understanding this endpoint is for me very important and critical to the success of my practice, and help me fulfill the patient expectation better as well. I'm using the L15 handheld ultrasound from Clarius, and I have been using it since 2021. So I recently got an upgrade. Now, the image quality even before was fantastic. What I get the upgrade actually is quality of life improvements. I can use my voice to activate and make my workflow a little bit more smooth, and then I can capture the image a bit more frequently now because I can just say capture and it will capture for me. And certainly it's also helped when I'm doing my procedures when my hands have to be sterile. I don't have to ask my nurse to record for me. Those improvements in terms of quality of life has been excellent. But then the portability of the Clarius, it has been life-changing because I carry it with me, during consultation, post-op, intraoperative, I just carry it with me everywhere. I sometimes go to other hospitals and operate, and they don't have an intraoperative ultrasound, but I already have mine with me. So the portability is a strength that I have not seen in other devices, and I have not seen any compromise on image quality in terms of what I'm seeing now versus what I was seeing when I was doing my residency and having a big, huge machines next to me. My advice to other plastic surgeons regarding the use of ultrasound in their practice is to start using as soon as you can. You may not need it, but you will realize that you will reach a higher ceiling of capabilities and you will enjoy your work a lot more. I would say that for consultation, it won't cost you extra time because you are doing the consultation as you are performing the scan. So it blends very well with your flow. In fact, it can help you shorten the time because the patient has a better understanding of anatomy of their problems, and you have a clear problem list that you can list out and you can consult the patients better.